There is no commercial support for today's program. Any financial relationships of the planners and speakers with commercial interest have been mitigated. A link to the evaluation will be passed out and posted in the chat. If you are ABS certified and want NGHS to report your CME credits to ABS, please fill out the evaluation and give us permission. If you have a question for the presenter, please hold until the end of the talk. If you're attending virtually, you may enter your question into the Q&A section and we'll read it aloud. And now it is my pleasure to introduce our speaker for this morning. Mary Hunter is a PGY5 surgery resident at Northeast Georgia Medical Center. She is originally from Chapel Hill, North Carolina, and is a Carolina Tar Heel, born and bred. She received her BS and her Bachelor of Science in Biology and Bachelor of Arts in Spanish from the University of North Carolina at Chapel Hill in 2013. She received her medical degree from the University of North Carolina at Chapel Hill in 2021. Mary Hunter is an aspiring pediatric surgeon dedicating the next chapter of her training to further developing her skills in clinical research in pediatric surgery and pediatric trauma. After graduation, she is moving to Atlanta to complete a year as a pediatric surgery research fellow, followed by a clinical year in pediatric trauma surgery at Children's Healthcare of Atlanta, in preparation to apply to pediatric surgery fellowship thereafter. In her free time, she loves spending time with her husband, Will, and their 5-month-old son, John Henry. Please join me in welcoming Dr. Mary Hunter Benton.
So today I'm going to talk about resilience and peak performance in surgical practice. And it is my hope that everyone can learn a little bit from this talk, no wonder what your profession or undertaking is. I have nothing to disclose. So my learning objectives for today. First, I want you to understand the behaviors and mindset that lead to and derive from the mastery of any craft, but in our case, surgery. Then, I want you to explore your own mindset and beliefs about yourself. And by the end, I would like you to understand how these have both helped you achieve greatness, but also can prevent you from fulfilling your potential. So a little bit of a disclaimer. I have absolutely no background in psychology, as you probably noticed in my biography. However, I do have a lifetime background in competitive athletics, and I, starting at the age of 7, all the way into my 20s, was an internationally competitive jump roper. And I traveled around the world to more than 20 countries representing our sport. And at the peak of my career, I was a national and world champion and am still a world record holder. And for medical school applications, you may remember that we had to cite the hours that we spent doing our extracurricular activities. And I did some math and calculated that I spent more than 3 consecutive years of my life in the gym in my childhood and early adult years. And through this, I was trained in performance psychology and learned how to master a craft and had lots of successes and failures along the way that taught me how to be mentally tough. And a lot of these lessons are the same lessons that I lean on in the operating room and life. And it's something that we don't necessarily get formal training on in residency. So if you don't come from a background where you have really taken time to think about these things before, I think it's helpful to review them right now. These are just some pictures. So at the top, every year we had our national championships in Disney World. On the right, that is my best friend and I. We did a show on the Great Wall of China when we performed at the Olympics in Beijing in 2008. And on the bottom left, that's where we performed on the Martha Stewart show when I was in maybe like 9th grade. So what is psychology? It has Greek roots, and it is the study of the psyche or the soul. And it's the science of behavior and the mind, and it seeks to understand the behaviors of groups of people. And what better groups of people to study than surgeons? So this picture is from 1985. At that time, it was the National Geographic Photo of the Year. And this is a Polish surgeon. His name's Dr. Religa. He is a cardiac surgeon and was later a politician in his country. And this is him after he completed the first cardiac transplant in Poland. And he and his team operated in excess of 20 hours during this case. And in the picture, you can see him sitting with his gown and bloodied gloves, and he's monitoring his patient's vitals after that long operation. You can see who's probably his assistant. Maybe it's the anesthesiologist. Just kidding. Sleeping in the corner. And he is showing the commitment that you would expect out of any surgeon, which is dedication to our profession and dedication to our patients. Our job is undeniably difficult, and we spend a lot of time training to do this. We devote time and commitment and effort to our skill and mastering it. And during this process, we are pulled from our family and friends to do our jobs routinely. And in surgery, we reckon with difficult complications and decisions. But I think it's important to stop and remember how much good we can do in this job. So these two pictures were taken 25 years apart, and this is Dr. Religa's patient pointing at the National Geographic Photo of the Year. And he lived 25 years after that operation because of the surgeons and the team's skill. And so I think it's important to remember and reflect on all the good that we can do. So how do we get there? This starts with deliberate practice. And I have, over the years, become fascinated with how we develop expertise. And this comes from the theory of expertise and deliberate practice. And the path towards expertise in technical fields particularly has been studied in the science of psychology. And there's some simple principles that we're going to review today that can be applied by both learners and expert coaches that can accelerate learning when they're applied throughout your lifetime. So pictured at the bottom here is Anders Ericsson. He's a PhD psychologist from the University of Florida, and he spent his lifetime and academic career exploring the psychology of expertise and human performance. And he studied these in a variety of settings, including surgeons. And he really looked at how practice and certain types of practice lead to expertise. So in 2016, he published a book called Peak, where he really debunks the idea of natural talent. So he points instead towards the foundational components of expertise that are exposure, focus, and deliberate practice. And he talks about the allure of natural talent, and I think that's an undeniable concept, but this paradigm really implies that mastery has preset limits, and I don't believe that's true. There's no evidence for superiority of natural talent over persistent and focused practice. And the real essence of mastery lies in recognizing our universal adaptability and then harnessing it through intentional actions and intentional practice. So in his book, he talks about 3 forms of practice. Those are naive practice, purposeful practice, and deliberate practice. So in naive practice, you do something repeatedly. So maybe think about knot tying. And if you do something over and over and over, eventually, yes, you will get better at it, but you will find that you hit a plateau or a stage of arrested development where you're not making much more improvement. In purposeful practice, you start practicing things that you aren't currently good at. And on the opposite side of the spectrum, in its full development, we have deliberate practice. So what is deliberate practice? It's the gold standard for performance improvement. It requires identification of expert performers, and it requires having a teacher or a coach. And that's because it is dependent on feedback, so you have to seek input. The feedback should be detailed and immediate. It should be personalized and goal-oriented. And it will allow you to identify and correct deficiencies so that you can practice what you're not good at. And it will give you the opportunity to improve your performance through task repetition However, the most important part is that it requires being outside of your comfort zone after you identify and target your deficiencies with the help of your coach or teacher. And this really requires your full attention and conscious effort. And I don't know about you, but this sounds a lot like how we train surgeons. So this is an article called Personal Best by Atul Gawande, and it was published in the New Yorker in 2011, and it reflects on the importance of having a coach specifically as it applies to surgery. And he details being at what he thought was the peak of his attending career, where he then experienced a plateau in his performance. And at this time, he looked at other fields. So he thought about athletes, he thought about musicians, and he got the idea to invite a former attending of his, who was a then retired general surgeon named Dr. Osteen, into the operating room with him to observe him and his practice and his team. And he started with a routine thyroidectomy, and he described what he thought was a flawless case. But at the end of the case, Dr. Osteen came to him with pages and pages of notes on suggestions of how he could improve. Everything from the way he was draping the patient to where he stood at the table, how he utilized his assistant, and how he handled the tissue. And these were feedback that he was really unable to see from his perspective at that time. And so it really advanced what was already a very honed practice. And I think this underscores the importance of constantly seeking feedback as a part of deliberate practice. And it allows you to take advantage of another perspective where then you can identify weaknesses that you couldn't previously see and improve upon them. So how do we do this in surgical training? We work on the basics first. And one of the settings we're able to practice the basics is in the simulation lab. However, I think it's important to discuss that the simulation lab is best utilized where you have people with you practicing with you. So you need a coach, faculty or senior residents that are there to facilitate helping you find your weaknesses so that you can focus on them and develop them into strengths. You all know that if you keep practicing what you're good at, you might be comfortable and it makes you feel good, but you will not get better overall. So you need to identify your weaknesses with the help of a mentor and work on that. We can also practice this in the operating room. And this is a great use of video review, which is pretty easy to do on the robot. You can record your cases and you can review your own tapes. You can identify parts of the case that didn't go well, and you can work on those aspects and turn them into your strengths. So where do faculty play a role in this? They are responsible for modeling expert performance. And this allows us to identify the gap between our level of performance and that of an expert faculty. And they will help us identify our weaknesses and so that we can train them. And once our performance improves, you find a new weakness and then you focus on that. So in summary, deliberate practice is how you master a craft. And you don't want to practice until you get it right. You want to practice until you can't get it wrong. So throughout this presentation, we're going to do some case studies on people that will hopefully bring these concepts closer to home. And to provide a real-world example of an expert in their craft, I thought I'd look no further than our own faculty. And when I think of deliberate practice and experts in their field, I think of Dr. Gersh, who is truly one of the greats in robotic cardiothoracic surgery. And she became an expert in her field with decades of dedicated practice. And when I spoke to her about this, it became clear to me that she purposefully was seeking out training and feedback from expert mentors. And through mentorship and decades of practice, she really became an expert in her field. So looking at a couple of these pictures, on the left is Dr. Chitwood, and he's Dr. Gersh's mentor. He's considered the father of robotics. And she trained with him in 1994 to 1998 as a medical student, and then did robotics research with him at East Carolina University. And then she later returned as his robotics fellow in 2006, 2007. In the middle is the Da Vinci Standard, which was released in 1998, and she had the opportunity to work on this system at East Carolina in their lab. And this was the very first Da Vinci system. On the right is Dr. Gersh and Dr. Wiley Nifong. He's a cardiothoracic surgeon who's also widely recognized as a profound teacher. And he also worked with Dr. Chitwood. And he has trained hundreds and hundreds of robotics teams around the world. And after learning from this, Dr. Gersh is able to do the same thing. So on the left, we have Dr. Gersh in a robotic mitral valve repair in 2006. And she performed greater than 300 valve repairs with Chitwood that year. And they published hundreds of papers on the approach, feasibility, outcomes, and they were truly the first to do this and were the pioneers in this field. She also had another mentor named J. Michael Smith. He gave a grand rounds here recently, and they performed the world's first dual console, totally endoscopic robotic CABG. So in the middle is Dr. Gersh with her then fellow, and they're performing the first dual console Da Vinci SI lobectomy. And this was in 2008 before the commercial release of the SI, which was later came out 2009. And she actually partnered with Intuitive to build the SI and the XI and is responsible for several well-known instruments that we use on the robot every single day. And so for her pioneering efforts built out of years of deliberate practice, she is recognized nationally and worldwide and continues to be recognized as one of the leading surgeons in this country performing robotic-assisted heart and lung surgeries. And like we've seen, her success comes from years and years of deliberate practice, and we are really lucky to have mentors like this here at our own institution. I gave this talk for my husband last night, and his only feedback was, I know you love Dr. Gersh, but you love her so much, so make sure you get to the point. Okay, so deliberate practice is not enough. Next, we're going to talk about grit, which is passion and perseverance for your long-term goals. And grit truly debunks the idea that success comes from innate talent or ability, and it praises effort and resilience as ways to grow and succeed. So Angela Duckworth is another psychologist that wrote this book called Grit. And in her book, she talks about the parts of grit, which are perseverance and passion. And she made a 12-question grit scale that she published and that they have used to study success in the military, and they've actually later applied it to surgical residency. The first 6 questions focus on perseverance, which is the ability to persist through your obstacles. So it's questions like, I have achieved a goal that took years of work. I've overcome setbacks to conquer an important challenge. I can finish what I begin. Setbacks don't discourage me. I'm a hard worker and I'm diligent. And you rank how those statements apply to you. And then the second 6 questions focus on passion, which is how consistently you can maintain these interests over time. So the same thing, you apply it to you. I often set a goal and later choose to pursue a different one. New ideas and projects distract me from old ones. I become interested in new pursuits every few years or months. My interests change year to year. I quickly lose interest, or I have difficulty maintaining focus. So you rank how these apply to you, and it gives you a score. And this grit scale was published, and they actually use a modified version of it in West Point admissions. And grit, after studying it, was shown to be the sole factor that predicts attrition or lack thereof in the military. And they later applied this to surgical residents in multiple studies and showed that grit is inversely proportional to burnout and attrition in surgical residency. Unfortunately, this is not something that's innate, and it's something you can grow over your lifetime. So how do we do that? It's important to say that effort counts twice. So you have talent and you apply effort to that talent and you can develop a skill. You have a skill and you apply more effort to that, and that's how you can make an achievement. So let's consider Michael Jordan. He was undeniably a talented basketball player, but he put in a tremendous amount of effort. And without argument, I think he's one of the best, greatest basketball players to ever play. And he applied effort to his skill over and over until he became that way. And finally, you need to be resilient. So the resilience is the ability to rise when you fall down. And this takes work and practice. So grit grows with time. When you're resilient, you learn from your failures and it enables you to soldier on. You set a long-term goal and decide where do you want to end up. And you start with short-term goals that you can align with your ultimate long-term goal. By applying deliberate practice, you can eventually meet them. There's a process of continually reassessing your goals and then shifting them as needed. And you should never feel that all your goals have been met. And if they are, you need new goals. And finally, grit requires purpose and hope. So hope at all stages of development. You have to keep going when the going gets tough. You have to fall 7 times and get up 8. This is undeniably a part of surgical training and something that everyone in here needs to learn how to do. So for a case study on grit, does anyone recognize this young, handsome soldier? When you figure it out, shout it out. You might recognize the lovely lady next to him. This is our very own Dr. Nate Graybill. So when I think about grit, I think about Nate, Dr. Graybill. It takes a lot of grit to do a lot of things that Nate's done in life. He was he's an Army Ranger, and he is doing surgical residency in his 50s, right? So let's talk about it. Nate gave me some pictures. On the left, this is his basic training photo as an E1 private. In the middle, that's Nate and Christy. You can see her hair from the 90s. And on the right, that's their wedding honor guard. I wish I could make the picture bigger. Okay, on the left, this shows the honors graduates from the infantry officer basic course. And in the center, this was shortly after Nate's commissioning. And then on the right, you can see Nate jumping into Fort Benning after flying in from Fort Bliss. You should ask him to tell you the story about that plane ride sometime. So Nate was an Army Ranger, which is widely touted as one of the most difficult accomplishments in the military. And when we were talking about it the other night, he told me that he actually had to recycle through his training after an injury that he sustained during a rappelling exercise. And he spent 2 weeks in the infirmary in Dahlonega and got recycled to the next class and then finished as an honors graduate and actually received an award for the best peer reviews in his class. And like I said, Nate told me lots of stories about Ranger School, and I'm not going to try to retell them because I can't do them justice. But when I asked about grit and how it relates to military and residency, Nate said, "My worst day in residency is nowhere near my worst day in the military." He described being in the field for 22 hours a day for weeks in a row, only being allowed to eat 1 MRE meal per day, and having to physically perform and lead groups in the freezing cold after not sleeping for multiple days in a row. And these conditions were designed to instill something that he described as battlefield stress. And from this, Nate said that he learned how to lead when no one wants to follow. Sound familiar? And he said that when I asked Nate how he applied grit to being a surgical resident, he said it's about understanding how far you've been before and knowing that you're nowhere close to that limit and pushing on. So finally, we're going to talk about mindset. So what is a mindset? It's a set of attitudes that you hold about something. And Carol Dweck This is a really good book if you haven't read it. It's by Carol Dweck. She's a Stanford psychologist and has done a lot of work on the concept of mindset. And she really dichotomized mindset into two types of mindset, a growth mindset or a fixed mindset. If we approach things with a growth mindset, you see your intelligence as something that's malleable and challenges as an opportunity to improve. People with a growth mindset seek feedback, and they're inspired by the success of others. Now, those with a fixed mindset believe that intelligence is something that is fixed. They're likely to give up when frustrated. They don't seek out feedback because they see it as a threat. And there have actually been many experiments on this subject. They did some in children in a school setting, and they split the kids into two groups. They gave them a task. And to one group of kids, when they completed the task, they told them, "Great job, you must be very smart." And to the other group of kids, they completed the same task, and they were told, "Great job, you must have worked really hard." And then the same two groups are offered another task or challenge. And they saw over and over that the group that was praised for intelligence was much less likely to take on a new task. And if they did take on the new task, they gave up on it much earlier than their peers. So I think we know that approach and mindset are important to how we frame our learning as well as our teaching. So like I said, when people with a fixed mindset meet a challenge, they will avoid it. They will avoid it because if they fail, and failure is an intrinsic failure of yourself, is how they think about it. And they can't stand this kind of judgment. They don't want to apply effort to anything because they believe effort is something you innately have or don't. And they shy away from criticism because they believe is criticizing them personally. They feel threatened by the success of others because it highlights the gap between their performance and that of others. However, people with a growth mindset believe intelligence can be developed. They embrace challenge and see a problem and know that they have to find a way to solve it. They're able to get through their obstacles, and they love criticism. And it highlights their weaknesses for them and shows them where they can work next. So we have reviewed the concepts of deliberate practice, the importance of grit, and a growth mindset. And when you combine these things, you can reach a flow state. So what is a flow state? Is the sensation of optimal experience. And there's 8 major components outlined in this book that I've pictured. They're tasks that you can complete. You have the ability to concentrate. You have clear goals and immediate feedback. And deep but effortless involvement that removes extraneous concerns. You have control over your actions. And when you're in a flow state, your concern for self disappears and your sense of time is altered. So consider these 2 hypothetical situations. The first one is a day in clinic. You were probably up late operating the night before. Every appointment is double booked. The first patient is late. You can't find the records and the prior op notes in Epic, and you left your badge at home this morning. Conversely, think about a day in the operating room. So think about your favorite case. I have pictured here an inguinal hernia, but think about your favorite case. Your patient is a 22-year-old guy with a BMI of 22. They have no surgical history. And you have your operative A team. The case goes seamlessly. No blood is shed. You have no interruptions during the case. So this is you in your flow state. You are enjoying yourself, and time passes in an instant. So in summary, we have chosen a challenging field. You should always question the paradigm of natural talent and adopt deliberate practice. By having an organized, intentional practice plan, being cautious of comfort, and seeking honest feedback, And this will allow you to look at your weaknesses and then practice them. Effort counts twice, and we all fail sometimes, but failure is an opportunity to learn from your mistakes, and you need to practice to avoid repeating those mistakes. And finally, you need to make the most of this time in supervised training and all the opportunities we have here at Northeast Georgia.
Thank you, Dr. Hunter. If anybody has any questions, please raise your hand. I'll bring you the microphone.
When Mary Hunter told me she was doing this presentation, I thought this was perfect because you guys have so much grit, and not only are you spectacularly intelligent, but you have a lot of grit. And I have been so impressed with each of you. And I sincerely, when she said this, I was like, this is the perfect presentation, because that grit you had when you were 5 and 6 and 10, and you knew who you were and you knew where you were going. And the challenges that you face in residency do not stop. They get worse. So as you become attending, the challenges then are not only just looking, how can you achieve the greatness that you're meant to achieve by, if you believe in your Lord, he put you here for this reason and you're doing it. But this challenge does not stop. And then the grit of learning how to navigate the challenges, meaning learning the administrative politics, learning the CMS guidelines, learning, you're never going to stop learning, and it's going to take continuously, right? When you think you've become an attending and all of these challenges are over, that's when a whole new world of challenges are there. But you have built an incredible foundation, and just keep your eye on the target of delivering the care that you know you were put here to do. Don't listen to the rhetoric. Don't listen to the noise. Keep your eye on the target, and each one of you are going to be so successful. So this is a phenomenal presentation, and something that all of us need to be reminded of how special every single person in this room is. And that regardless of the obstacles and maybe the deviations in your pathway, every one of you are going to be successful. So this great presentation. Thanks.
Okay, Mary Hunter, that was amazing. You are such a good speaker, so organized, so clear, and what a great topic. And I tell you, even in the year and a half since I left, you have grown so much. It's just been such a pleasure to hear you and Eminem and other things. And I'm so excited for what you're going to be doing. And I think this is a video presentation that we need to have or everybody needs to watch it once a year. But we need to have all of our incoming residents do it. I mean, I love what you said. One of my favorite things to say is, don't practice until you do it right. Practice until you can't do it wrong. That's why I have trouble showing people how to tie knots, is because I don't know how I do it. I'm just doing it, so automatically, because I can't do it wrong. And that's just so important. And I think, we know as faculty, we fail a lot of time in giving the direct feedback that people need. And I would just encourage all the residents, when you're in a case doing something, ask the faculty, okay, how did I do? Or right after the case, don't just send them an EPA, which they click a couple boxes and submit. Ask them, okay, what did I do good today? And what did I not do so well? And how can I do that better? And get that specific feedback. I mean, it's on the faculty to teach you, but it's also on you to ask for it, because the faculty are willing to give it. They just, you just don't think about it all the time in the business of the moment. So ask for that feedback, because I think all those points that you said are so true. And, grit and resilience, setting a goal and just sticking to it and working hard and getting where you need to go. I mean, talent and intelligence do have a role to play, because we don't all have the same gifts by any means. But we can make the most of what we have. And I think it's, the way to do that is by practice and sticking with it and asking for feedback and not giving up. So it was just amazing. Thank you so much.
Thanks so much, Dr. Strom. And I do think that's something that getting feedback in surgical residency, everyone knows the struggle that we have with that. But I think the way you need to think of it is, you need to take the responsibility for it. It took me a little bit to realize this and work towards it. But our attendings are really busy. I think EPAs haven't been perfectly implemented yet, but there is a way to implement them that can help with this, but it is really up to you and as a part of your professional development to seek this feedback, not just on the things that you're doing well, but more importantly, what are the things that I can work on? And Dr. Strom, bring me back. I'd be happy to talk to the interns next year. I'll just be in Atlanta.
Sounds like a plan.
Asking for help is not a show of weakness. That is a show of maturity, intelligence, and in your understanding of really where you are on the planet, in the universe, and what you need to achieve. Asking for help is not about you. It's about your patient. So stop and ask for help. It is truly a sign of strength. If you do not know how to do something and you keep your mouth shut and you push forward, there's a consequence to that. And you guys all have seen attendings not asking for help, and you knew in your heart, man, this guy needs some help, right? And you knew how you felt in that moment for the human on the table. So asking for help is paramount for growth.
Helen Ransom says, thank you, Dr. Benton. This is a wonderful presentation. How can you support your internal flow state?
I think a lot of it, and this is particularly as it applies to surgery, has to do with the people that you surround yourself with. My favorite, so like I said, I grew up as an internationally competitive athlete on a jump rope team. And that's the majority of that is done in teams. And we really practice so hard that, like I said, you can't get it wrong at the end of the day. In the operating room, it's the same way. And Dr. Gersh's team in the CVOR is a perfect example. When you have people around you that have similar goals, that are well-trained, and that know your communication style, and it's almost like you don't even have to communicate about some things because you all have similar goals and have done it so many times. To me, that's a true flow state. It will always involve a team of people doing an activity. That's at least my favorite example of it. And it's also my favorite part of operating as high efficiency teams.
Great presentation, Mary Hunter. I did have a comment about during the year, I think maybe people start off with those concepts really prevalent in their head, grit, trying to practice, but then throughout the year you get distracted. There are a lot of competing duties that you have to do. There are a lot of failures. How do you remind yourself to keep those principles prevalent in your head? Is there concepts like spaced repetition or maybe methods that you've used or seen come across in the literature about reinforcing these for residents particularly?
Certainly spaced repetition and practice, like you mentioned. But again, I would tie it all back to the people around you. Another one of my favorite parts of surgical training is, it's not probably best expressed like this, but the hierarchy of it, that's not exactly what I'm trying to say, but the fact that there's residents, it's a long process, and there's residents above you that have done this before, and they've been through the same challenges that you have been through. And I think when you are in a really tough spot, when you are exhausted, you don't know what to do, and you feel like you're far from mastering something, it's easy to seek help from those around you that have done it before. And that's something I don't want any of the interns or junior residents to forget, that we have done this before. We've maybe not the same challenges, but we've experienced a lot of similar challenges, and we're really here to listen and help you. I think the importance, you can't understate the importance of talking to someone who has been in your shoes and has done it before. So when you're having a hard day, I encourage you to reach out to your co-residents and particularly your senior residents, because I promise that we've had hard days as well. But together you can get through it.
Thank you so much for this excellent presentation.